greenhouse gas emissions still rose 2.3% to a new high in 2024, significantly overshooting the targets for bringing global temperatures back to pre-industrial levels. The main offenders: India, China, Russia, and Indonesia.
6 deaths are now blamed on a listeria outbreak linked to prepared pasta meals. They were sold at Albertsons, Kroger, Sprouts, and Trader Joe's. Dow's down 213. This is CBS News.
Think O'Reilly Auto Parts for all your car care needs. Get the parts and service you need fast from the professional parts people at O'Reilly Auto Parts.
This is the story of the one. As a maintenance supervisor at a manufacturing facility, he knows keeping the line up and running is a top priority. That's why he chooses Grainger. Because when a drive belt gets damaged, Grainger makes it easy to find the exact specs for the replacement product he needs. And next day delivery helps ensure he'll have everything in place and running like clockwork. Call 1-800-GRAINGER, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
eBay has reinvented vehicle buying. From click to curb, everything's covered. Ever try to buy a car online and end up in a parking lot with a stranger and some blind trust? That era is over. Now with Secure Purchase, eBay isn't just where you find your car. It's where you buy it, start to finish. Title, financing, registration, delivery, it's all built in. This is the modern way to buy your next ride on eBay. eBay. Things people love. Secure Purchase is powered by Caramel Dealer Services, LLC, an eBay subsidiary.
Whether it's a cough, a fever, or something you can't quite name, MMC Now makes care easy. Walk right in, get seen quickly, and your visit connects directly to your MMC doctor. Care you trust, with providers you know, with digital check-in and multiple locations around town. MMC Now is here when you need us.
Murfreesboro Medical Clinic.
Storm. Talk Radio WGNS Murfreesboro. FM 100.5, 101.9, AM 1450, TV 11. We're the Good Neighbor Network. FM 101.9 and AM 1450 Murfreesboro. FM 100.5 Smyrna. Audio and video streaming at wgnsradio.com. This is the Roundtable. A look at the news, views, politics, and people that are shaping Rutherford County.
And good morning, everybody. Welcome to your Tuesday morning edition of the Roundtable Show with your hosts, Rick and Wayne. Come to you every Tuesday morning here at WGNS, and it's a cool morning at WGNS this morning. Last couple of days have been pretty cool. How are you, Wayne?
I'm good. Good morning. Scraped a little frost off the windshield this morning. So
no kidding.
Yep. I was looking at the screen over here behind Brian, and the foliage is making its way.
I'm really seeing it on our road, which I've got a good bunch of good maples and oaks and things, and they're really starting to change.
What I love, College Street in Smyrna has a lot of oaks, and it's, after a storm, in the middle of November, it's almost like riding on ice. Those leaves are so slick, but it's beautiful.
Well, I wanted to talk the show about. We were so looking to the dinosaur story. I said dinosaur, didn't I?
Oh, the T-Rex.
The T-Rex. Sorry, I can't get those confused. We got zero pictures, man.
I'll just have to do it next year. I just couldn't find the costume. I guess it got past.
We did all that build up, and do we have a sound effect that says, "Oh"?
Well, maybe
we didn't get anything.
If I can find it here sometime, maybe I can wear it and be on the show with it.
I think maybe he should wear it as the two of you MC the Smyrna Christmas parade.
Now we're on to something. No doubt. He would definitely be warmer because, the pure embarrassment and redness will make him warm.
Yeah. Well, it'd go with my red neck, I guess, anyway. So,
that's right.
But hey, we're well into high school playoffs starting this next weekend.
What about Smyrna stepping up there?
Yeah.
Which Oakland's in, Riverdale. So Blackman, Smyrna, that's awesome.
What, great contingency from Rutherford County. So I have YouTube TV, and this Disney YouTube thing is killing me.
Oh, yeah, ESPN, losing it all.
Yeah, didn't get to see Game Day, didn't get to see Peyton and Eli last night. I'm in a much better mood than I thought I would be this morning.
Well, you didn't miss much on Peyton. They had Baker Mayfield, and Baker was in a bad mood for whatever reason last night. He wasn't very talkative. He was in a dark room. He just wasn't in a good mood.
Well, the reason I watch it is, to see Peyton and Eli do their brother thing and pick each other.
They do.
Spoil brat, big head, that kind of stuff. So it's a lot of fun.
It is a lot of fun.
So
I tune in as well.
Yeah. Rick, this morning, it's one of those informative shows. I think having Miss Malone here this morning to, most of us are, well, if not all of us, are taking all these obnoxious solicitation calls for Medicare Advantage or whatever they're trying to sell, and having Leanne Malone with Protect Your Assets.
Cover
my, darn it, I am 71, so not the first faux pas I've had here, but welcome and thank you for being with us. We know it's a busy time for you, but this is such a great service for our audience, so thank you for being with us.
Thank you very much. Yes, Cover My Assets Insurance Group is the name of our business, and we've been in Smyrna 20 years, so we specialize in Medicare and health insurance. So basically from birth until we can cover you with health insurance, Medicare, all the what I call the fun insurances. So, yeah.
I like Protect. I think maybe you need to change it. I don't know.
I'll look into another domain name is what I'll do. Maybe we can add it.
There you go.
I don't know. Everybody listening out there said that's the best name ever, because I know when I met her and I saw it Cover My Assets, I was like, that is so perfect, man.
We do still get phone calls. We'll answer the phone and people giggle and they go, "You answered the phone that way." I was like, "I pay taxes on this. Yes, I'm going to answer it this way every single time."
That's pretty cool. Yeah. I think we're going to cover several subjects this morning, but I thought you would, just go out and talk about Medicare and Advantage and Part D and supplements, just all there is to know about being 65 and over.
Woo. Well, and to be fair, you can be on Medicare and be under 65 as well. So if you are someone who has been on Social Security disability for 25 months, you actually qualify no matter what your age is. So, and there are two types of structures. I'm not supposed to really call them plans with Medicare, because A and B is what everyone has. That's A is hospitalization, B is medical. A is typically free, B is the one that comes with the premium attached. That's the one that always gives people sticker shock, because like we were talking about earlier, I paid in all these years. What do you mean now I have to pay for Medicare? Well, you do. Everybody ends up paying that Part B premium typically. And then you have a choice of either going with Medicare C, which is Medicare Advantage. That is a plan that covers both medical and Part D all in one plan. Or you can go with a Medicare supplement and a Part D, D for drugs. So there's different ways to go. I am a firm believer as there is not one right way for everyone to go. I think it is not only based on personal preference, but on your personal health. And one thing about Medicare I really like is it's not, we don't put husbands and wives on the same plan all the time because it's just cheaper or better together. I can put a husband who goes to the gym 5 days a week and never takes anything more than a vitamin C when he's got the sniffles on one type of plan, but a wife who has significant or major health issues on a totally different type of plan, because it's very customized for the individual.
The open enrollment's open right now as far as with the Medicare plans. So what's some of the, I guess, I don't know how deep you can get into this, but what's some of the changes? Because you're obviously, if you're already a customer, y'all are already making calls out to everybody to meet with you this year, because there should be maybe changes to the plan depending on if you've had prescription changes or things like that. So What's some big changes you're seeing? Because obviously with the shutdown, we're hearing things daily as far as our health care and everything that's going on.
Sure, and the shutdown hasn't impacted. Social Security has stayed open. That one has been exempt from the shutdown, so people are still able to sign up for Medicare.
Good.
They're still able to get those things processed, which is super important. There is a change in the Part B deductible, or I'm sorry, Part B premium, that is going from $185 to $206. We have been told that the upcoming cost of living adjustment is supposed to basically offset that. So yes, it is going up by $21, but that's supposed to be put back for those that get Social Security into their check every month come January. So at least that's sort of a net wash, which is not so bad. The open enrollment period does go until December 15. One of the big things that I want to say, because we're dealing with this a lot, we had it happen again this week. Medicare will not call you. Medicare will not call you, and Medicare will not call you. So when you're getting all these calls like Wayne was talking about, hey, if somebody says, hey, I'm calling from Medicare, no, they're not. Social Security doesn't call you. The IRS doesn't call you. That's misleading, and they're trying to sell you something. And the small amount of information it takes for them to switch your plan without your knowledge is astounding. Because all they say is things like, well, I'm just wanting to verify this. So if you'll just give me your Medicare card or Medicare number and your date of birth, your whole plan has changed and you have no idea. So just remember, Medicare does not call you. We, call from our agency certainly and check in with all of our people. We check to see that your drugs are either the same or have they changed. If you're on high dollar drugs, even if they're the same, it's always good to price those out, because if they're cheaper free now, they're going to be cheaper free next year. But if you're rolling in and paying big dollars for Eliquis or Jardiance or any of the big boys, those change every single year based on coverages, and you want to make sure that you're getting the best bang for your buck with those. So we do evaluations, and you should look at your plan, not necessarily change it, but look at it every single year.
Took your advice from last year when you were on, and
I'm shocked too. She leaned back when you said you took her advice. You're like, whoa,
wow.
Hey.
Well,
Thanks.
The phone calls just kind of irritate me, and I said, well, I'll just have some fun with it. And then I keep reading about all the things that, that happen to people that, accidentally share something they shouldn't. So I've just quit answering them. Mm-hmm. If I don't recognize the number, they'll leave me a voicemail or they'll text me, and if it's somebody that really wants to talk to me that I want to talk to. So I quit answering the calls.
Well, and you'll notice most of the ones that are truly unsolicited spam calls don't leave voicemails.
Right.
Because if you told me today, hey, I need you to talk to my neighbor or reach out to her about Medicare, I legally cannot, because I am not allowed to make I'm not allowed to make an outreach. They have to come to me.
Sure.
So these spam calls, they can't leave you messages going, hey, friend, just thought I'd check in, because then that's against the law. So if you just let them go to voicemail, they won't leave one.
Sure.
And it's kind of great because it's a nice little call screening tool.
Exactly.
So what's the average cost? So if somebody's 74 years old and they're on their Medicare plan, what should their plan, if they're on a regular drug, I won't say regular drugs, but their prescriptions are what you usually see: cholesterol, high blood pressure, things like that. So what around should their rate be?
Well,
that's a tough question, but there's got to be an average in there to where if somebody's out there listening and you say it's $100 and they're saying, well, I'm paying $500 a month right now. So.
Well, sort of. It depends on your plan type. So I can't, there isn't an average, because if you're somebody who went on a Medicare supplement before 2020, you're on a plan F. Your premiums are very, very high and significant. But I can say drug-wise, because drugs are kind of the great equalizer. Drugs are treated the exact same, whether it's Medicare Supplement Plus D or Medicare Advantage with Part D. Drugs are maxed out at $2,100 this year for covered drugs. That is a slight increase from this year. 2025, the max out of pocket was $2,000. One thing that's really good with drugs, one real big change that we're excited about is they've started something called an MPP. I wanted to call it an MSP because it makes more sense in my brain. MPP is a Medicare prescription program. You can actually reach out. So if you're one of those folks that have those super high dollar drugs, the big change is most of the plans now have drug deductibles. And so you have to meet a $600-ish drug deductible. Well, that makes your January really unpleasant because you go to pick up your 10 drugs and you have a $600 deductible plus all the copays. I've got clients that are seeing $1,000 and $1,300 Januaries. And that's just brutal. So you can talk to the drug company, sign up for the MPP, and what they do is they say, okay, so your total drug costs are going to be $1,500 over this next year. We're going to take $1,500, divide it by 12, and give you an interest-free payment plan directly to us, and then you get your drugs from us, whatever pharmaceutical company that is. So it minimizes that upfront damage because for me, January is my brokest month. I've spent all my money on Christmas. The last thing I want to do is drop $1,300 to $1,500 on prescriptions, but I have to have them.
Kind of define the structure of a traditional Advantage plan. How how it works. Because you have Medicare and then Supplement and then Part D, or you have an Advantage plan that does all three.
Correct.
Within one. Kind of share how that goes, how the drugs and all that works.
Okay. The typical Advantage structure is broken into two types. You have HMOs, which are the health maintenance organizations. Those are the ones that have networks. Typically no out-of-network coverage, meaning you go to your network doctors, you don't go to someone who's not in that contracted network. Or PPOs, which are preferred provider organizations. Those have in and out of network benefits. So you see everybody in this one network, but you want to see this one random guy over here, you can go see him at a slightly higher copay typically, or a percentage, just depends on what it is and who the plan covers. Why people like Medicare Advantage typically is it is zero to low premium. These days now they've got plans that do have some premium attached in addition to having some lower copays or lower out of pockets. So 0 to low monthly premiums, that is in addition to your Part B, because we all have to pay that. But this is in addition to it, but it gives you doctor copays when you go to the doctor. It gives you copays if you have PT. It gives you copays if you go in the surgery, and it has out-of-pocket maximums. So you have your worst year ever, you go in the hospital 2 or 3 times, chemo or dialysis, you could theoretically meet a $5,900 out-of-pocket maximum, but most people don't. Most people might have an outpatient surgery, $300 to $500. Couple doctor visits, $50 to $100 at most. You're maybe in for $500 a year in medical care on a good year, but you've paid in 0 to low money per month. So you're spending that money the way you want to instead of prepaying on premiums like you would with a Medicare supplement. Having said that, supplements have great benefits as well. They're just structured very differently. But Med Advantage has the added bonus of having prescription drugs included. So it's all in one card. It makes it simple and a convenient way to do things.
So is there gaps or donut holes in both Advantage and supplements?
No.
Okay.
They've done it. They actually, so there used to be the donut hole. We all talked about that with Medicare. That has now been eliminated. Now there are max out of pockets of either $2,000 or $2,100, but the plans, especially Med Advantage plans, have been allowed to add in those deductibles that used to be reserved for standalone drug plans.
Cool.
You talked earlier about going direct with a drug company. So how's that happen with a person?
So if you sign up for, I'm just going to say like a Cigna drug plan, which is now HealthSpring as of this year, you are with them. They actually will send you your drug card, your drug information, and things like that. And in that packet of information, they will have information. Optum, their pharmacy is, you would reach back out to them directly based on the piece of paper in your packet and set your payment plan up with them, because they're the ones that are going to know what your drugs cost anyway.
So is that something if somebody comes and meets with you, like during this time, that y'all go over and you're helping them with to do?
We can advise. We cannot sign up for things like MPP because that's not the part that we're allowed to do. But we can certainly tell you where to look for when the packet's there and make sure that you understand it's available. Most people just don't know it's available. And with these big deductibles, and again, $1,000 Januaries, I just feel like people need to know your option isn't doing without medicine in the month of January because you can't afford the pickup.
So a person listening out here and they're on up in age and they're hearing this and they want to be able to do it, if they've got a son or daughter that helps them with that, what would be the beginning steps of that? Look at their program and look at the number on the back of that card?
Correct. Call the drug company immediately that they're going to be using for 26.
Remind our audience how to get in touch with you and your team.
Sure. Our office number is 615-345-0411, or you can find us on the web at covermyassets.com.
And if you giggle, that's okay, right?
If you giggle, we expect it, and we appreciate it.
You've hit the right spot.
That's the one.
And I'm sure we'll do this several more times before the end of the show, but you provide one heck of a service, especially so many of us that are well past 65. Technology has kind of passed us by, and having someone that's confident and capable, to have access to is extremely important.
Thank you. I feel really blessed doing what we do because we get to help people every single day, whether it's under 65 having babies or getting married or retiring or, going through the loss of a spouse or a child, knowing that you've got somebody in your corner that can help you with those hard decisions in a time where you just need help. And we're really honored to be able to do what we do.
And I know we're going to talk about marketplace, in this second segment, but I always advise anybody that says they're going to go on marketplace, do not give them your telephone number or they will wear you out.
Correct.
Same with the online. If you click something online and you start putting your general information in, it screen captures that and they sell the heck out of it. It goes everywhere.
Yeah.
And I mean, that's a good thing about, when I met Leanne and her company over there, because my office used to be out there, I literally think I've sent hundreds to you now over the years. And even I had a buddy just call me the other day that I graduated with that's changing jobs. So he's going to have his 30 days and he'd have to go to this high-priced Cobra plan or something before he figures out what he's going to do. And I believe he might have called you and she's got him set up. So it's just... I feel fine when I send people to them because I know they're going to take care of them. So I really appreciate that.
At one time prior to Obamacare coming on, you could, we sold some 30 or 60 or 90 days temporary coverages. Is that still available? Is anything like that out there?
It is. And not only that is it available, they've actually extended those plans up to 3 years.
Really?
And we can do 3-year rate locks, which are my personal favorite, because I'd love to know what I'm paying 3 years from now. That makes me happy. They are absolutely not right for everybody. But for those folks that don't have any, at this time, major pre-existing anything to where they're basically wanting, my mom told me I had to call you and get insurance, and I get those calls a lot from 26 to 30-year-olds especially, then we put those in place. We put them with a rider for virtual urgent care, some virtual prescription care, and usually an accident policy, because most likely way you'd hit your deductible is to snap an ankle in a gopher hole type of things. They are so affordable. They are a third or sometimes a fourth of the price of a marketplace plan because they don't cover all of the things that marketplace does, but not everybody needs that level of coverage.
Well, somebody just graduated from college looking for a job, or somebody in transition from one job to another.
Yep.
That's huge.
Oh my goodness. I was talking to somebody Friday, and they called, we were talking about it, and I gave them the price, and they got real quiet, and I was feeling really awkward because I really thought this was a good price, and now I feel really weird because it sounds like they're really upset. Well, I was quoted $1,200. I was like, oh, I can spend more of your money if you would like. And they were like, no, we don't want you to spend more, but are you sure your price is right? I checked it twice. It was 1/4 of what their COBRA was going to be.
Wow.
But again, it's not meant to cover everything forever.
Sure.
It's not meant to cover pregnancy. It's not meant to cover an upcoming knee replacement, but that's not why they needed it. They needed it because they needed coverage ASAP that was going to cover anything that would happen tomorrow. And that's exactly what we did. But yeah, I was a little taken aback because there was just dead silence. And I was like, ooh, that was not what I was expecting. I was expecting, okay, that's pretty good rate. Once they started talking, they were very happy, but it just took a minute.
Can that also be used as credible coverage?
It is not considered credible coverage.
Okay.
So if you, and we have this happen a lot, we'll have a couple get on a plan like that and they're wanting to have a kid in 2 years. It's great for the year they're not wanting to get pregnant. On the year that they do want to get pregnant, we move them over to Marketplace. They understand the premiums are going up because the coverage increases.
Sure.
That's fine. But if there was to be a pregnancy in the middle of the year, that is not a credible situation to where they could get on Marketplace as a special enrollment. But we're very clear in saying those things and honestly asking intrusive questions. I never used to have to ask anybody if they were planning on getting pregnant, but now it's very relevant because of the coverage types.
So don't have accidents.
You can have happy accidents all you want to. We have workarounds for that too. It might just cause a few more gray hairs on my already gray hair head. So yes.
Or losing hair.
Well, I'll leave that to y'all. Mine's just turning gray. So
Man, I know.
I'm getting tinsel in this hair. It's okay.
I'm 2 weeks out from turning double nickels, so it seems like every day I wake up it's a little bit whiter.
Hey, just enjoy your youth. That's all I can tell
I did that in May. It's not as bad as you think it is.
Yeah. I'm not wishing it away, but I'm all right with it, I guess.
Mm-hmm.
Yeah. What's some epiphany that you can share with the audience when it comes to searching for the best coverage for them in, between the Advantage or the supplement? What got, when you're going through explaining to them what you have available to sell them, how do you formulate your investigation as to what serves them best?
Sure. We base it entirely on doctors and drugs and usage. So, because it's different at 65, when you're at 65, you get two different choices you can make. That's when you choose to either go with a Medicare supplement and Part D or Medicare Advantage. After that, so like right now, just at open enrollment, if you and I were having this conversation, what I would do is get a list of doctors, get a list of drugs, and then I have those lovely big 24-inch monitors we all have now. I just flip my monitor towards you because my comparative rater shows every single one of my carriers, starting with the cheapest drug cost for you, going down to the most expensive drug cost, and they base it on who your doctors are, or if it's just a drug plan, who covers all of your drugs in the less expensive, most cost-effective way. And I have no issue whatsoever flipping my screen around and letting everybody see it.
How many carriers do you represent?
I represent all that I'm able to in Middle Tennessee, meaning if it is an exclusive contract, like if you are and I am going to say it, Farm Bureau, for example, we get a lot of calls. I'm not a Farm Bureau agent, so I can't sell Farm Bureau products. So I can't say I'm licensed in all because I can't be licensed in that one, but all that I'm allowed to be.
Right.
I have to be careful with my Medicare verbiage.
When I'm looking at Part D, and I put my zip code in, and they give all the when I tell them what pharmacies, and they go through and give me all the prices, and I see everywhere from very little cost to extreme cost.
Mm-hmm.
I'm thinking, why does anybody buy one of these higher price tiers when you can have almost nothing premium wise? Of course, everybody I think the Part D deductible goes up to $600 this year.
It's around there. Each company can set it, but around $600 to $615.
So is it because of the more expensive prescriptions that the higher premium tiers? I just thought, why would you even advertise it when, say, this company says $5 a month,
mm-hmm.
and this company says $50 a month? So
I've got people on the $120 a month plans, and I never thought I would do that. But when I put when I put all your drugs in the comparative rater by dosage, there are times when the drugs are covered differently.
Okay.
So, for example,
Okay.
you roll with a statin and a blood pressure pill, and that's all you've got. A $5 plan is your jam. That is the best thing for you because you aren't really spending any money on those drugs. You're just paying that tiny little premium.
Sure.
But you hand me, and I had this happen last week, a 1.5 page typed drug list. And that took 20 minutes to put all those into the computer and price them all out. The only one that carried every drug covered was the $120 plan. But it also waives that $600 deductible.
Okay.
So it ends up costing them less money. And again, I flip that rater around so they can see this says $2,100 plus my premiums versus, $5. And then, 3 of my really expensive drugs aren't covered. And then you're looking at $60,000 out of pocket.
I assumed that was the case,
Mm-hmm.
but I needed someone with more knowledge than I had to share that. So
I think we're coming against our first break here, but you're listening to Leanne Malone, and she is the owner of Cover My Assets.
Not protect, cover.
That's right. Cover My Assets.
Maybe I'll get that right at the second.
Let's hope so. So her phone number is 615-345-0411. So, and it's covermyassets.com if you want to go on your phone or tablet right now and punch that up. But we're going to do our first break and be right back with you in just a minute.
Whether it's a cough, a fever, or something you can't quite name, MMC Now makes care easy. Walk right in, get seen quickly, and your visit connects directly to your MMC doctor. Care you trust, with providers you know, with digital check-in and multiple locations around town. MMC Now is here when you need us.
Murfreesboro Medical Clinic.
What's the location of your emergency? I think my kid OD'd.
Hi, I'm Craig Harris. I'm County Commissioner of Rutherford County. One of the reasons I ran for office is because I wanted to bring awareness to the opioid epidemic that's impacting our county. To stop providing this epidemic with people as we educate. We have a lot to do, and we have to come together as a community because this problem's not going away.
Are you tired of feeling like just another number with your insurance provider? At Rayburn Insurance Agency in Smyrna, Agent Rick Hall prides himself on offering personalized service that puts you first. Every client's needs are unique. From personal home and auto coverage to tailored business insurance, Rick Hall's got you covered. Rick Hall at Rayburn Insurance Agency in Smyrna, where you're more than just a policy number. You're a neighbor.
This is Chip Walters, and I'm honored to be your 2024 MTAR Realtor of the Year. I'm with Exit Realty Bob Lamb & Associates, and like many of you, I've seen the real estate market shift and change. People often ask, Chip, what's really going on? Well, that's a great question, and I believe in answering with solid factual data. So let's cut through some of the noise. I invite you to reach out. Let's have a conversation about your real estate goals and the current market trends in your neighborhood. You can find all my contact information at choosechip.net.
Good Neighbor Events is brought to you by the law offices of John Day, Americare Pest Control, and Old National Bank.
This is a paid legal ad.
When a family member is lost as a result of someone else's negligence, the grief can be unbearable. It also leaves you with a lot of questions like, how did this happen? Who's responsible? And is my family going to be okay? That's a lot to go through, but with the law offices of John Day on your side, you don't have to go through any of it alone. We understand what you're going through, and we have the experience to get the answers, justice, and compensation your family deserves. Call the law offices of John Day.
Now, WGNS Good Neighbor Events. West Side Story opens this weekend at the Center for the Arts in Uptown Murfreesboro. And over at the Arts Center of Cannon County in neighboring Woodbury, this Saturday afternoon at 2 is the final performance of The Phantom Toll Booth. The kids will love it. 2 o'clock this Saturday afternoon. Phone the Arts Center of Cannon County for more information. The Arts Center of Cannon County is at 1424 John Bragg Highway in neighboring Woodbury. And here's more big news. The Rutherford County Farmers Market continues through fall and winter, all the way up until May. It's the new Fall and Winter Farmers Market, still at the Lane Agri Park. It's only on Friday mornings, though, opening at 7 a.m. until noon. That's going on now through April. Don't throw away Old Glory. Bring your tattered American flag to WGNS. And let the girls from BSA Troop 2019 at Trinity United Methodist Church retire it with dignity. Plus, we also recycle Bibles. Those are WGNS Good Neighbor Events.
Rutherford weather.
We'll see sunny skies here for this afternoon with a high in the upper 60s. Tonight, mostly clear, low near 47. Wednesday, sunny high of 73. I'm meteorologist Jennifer Wojcicki from the WGNS Rutherford Weather Center. Currently, it's 47.
WGNS is powered by Middle Tennessee Electric. Through Sharing Change, MTE members round up their bills to support local nonprofits. Find out more how your spare change can make a difference at sharingchange.org.
This is the Roundtable from News Radio WGNS on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at wgnsradio.com.
And good morning and welcome back to the second segment of Tuesday Mornings with Rick and Wayne. And it's our pleasure this morning to have what we think one of our more informational show. We have Leanne Malone with Cover My Assets with us. I needed to be correct on it the second time around. So thank you. You've already shared a ton, dealing with Medicare and Advantage and Supplement and Part D. But I think this second segment you were going to kind of talk about the Marketplace.
Sure. So Marketplace opened this past Saturday. We started.
Start with what is Marketplace for those 30-something-year-olds that are coming off parents' insurance.
Sure. So back when I first started in insurance, which was 20 years ago, this was not around. So it was private plans you had group plans. In 2013, Marketplace started at that time. It was called Obamacare. We still get phone calls asking, I don't want that Obamacare. Okay, I won't sell it to you, but I'll sell you Marketplace because it's the option that we have. As far as policies that cover pre-existing conditions, cover pregnancy, cover very comprehensive coverage, all your preventative care. That's what Marketplace is. So it's called Obamacare, is Marketplace. There's a whole lot of other terms I don't really say out loud very often, but it is the most comprehensive coverage. It is not necessarily right for everybody. It is right for a lot of people. What we are seeing this year with the government shutdown, part of the shutdown is there are tax credits given, meaning your plan is not, the price is not the price, is how people look at it. So I've got quotes pulled up for this year with a 32-year-old, a 30-year-old, and a 2-year-old. So a family of 3 making $110,000. It starts at $1,300 a month as far as premium, because the enhanced tax credits are now gone for now, assuming they don't restore them for one more year. This is what we're looking at as far as premium goes. So all of a sudden that $110,000 income, which doesn't sound that bad, I mean, it's a livable wage, is reduced by $1,300 a month. And the part that is so troubling to me anyway is that's with a $7,500 individual deductible and a $20,000 out-of-pocket maximum if there were something bad that were to happen to 2 different members of the family. It gets frustrating. We typically tend to plans that have copays. So like the 2 plans I have pulled up, one's $1,374, one's $1,397, but they have doctor office copays of $50 for primary care, $100 for specialists. So you do get a few first dollar benefits. You can roll to the doctor a few times because we're in Tennessee and you're going to have the snots and sniffles at least twice when leaves change. It's just how we roll here. So at least you know that's only $50, or a specialist is $100, instead of looking at, I can't afford $7,500 just to go to an allergist. So it's got that in there. What they're doing with the shutdown now is trying to decide if they're going to keep one more year of the enhanced tax credits, because if they did, that $1,300 premium would drop down by about $500 down to $600 a month.
Wow.
It's that much of an increase or difference. So my sincere hope is they do pass those one more year just for open enrollment, because doing it this late in the game is troubling for me and in the industry that we're in, because there's so much uncertainty and people are we're already talking to people saying we're just doing without insurance this year because we can't afford $1,300 when we only make $110 a year. That's a huge chunk of their budget. My hope is also that there is some actual reform finally, to where some private policies come out that are have less benefits in them, or you can cafeteria style it. So a 55-year-old doesn't need maternity. They just don't. Right. But they do need advanced preventative care. So let's pull some of these benefits out and make them to where you can choose them, or have plan structures that are that way, because not everyone needs the same health insurance. A 26-year-old does not think about maternity as a single male. He just realized he got kicked off his parents' insurance and he just needs something he can afford on his check. These plans have him at, $250, $300 a month. That's not really sustainable if he's already somebody who doesn't go to the doctor. Mm-hmm. So it's just kind of a different way to do it. But some of the plans you were talking about earlier, we can do off-marketplace plans as well if they fit that individual. They are not for everybody.
So, I don't know, I'm looking at from my conservative mind here that when we did away with the EV car mandates, the $7,500 tax, it's like all of a sudden the car market, because that all that free money they got for every car they made that had a battery in it, the government wrote them a check if they sold the car or not, they've done away with. And this is basically the same thing now. They're playing the same game with healthcare. So if you're $1,200 a month and it goes down to $500, so they subsidized that difference, that $700 a month difference that somebody would have paid. So it's government paid healthcare, a part of that act there. So I don't know, from a Republican-led Congress and Senate, that, like you said, they've got it so late in the game right now, the Democrats making the stand and not having enough votes to fund the government. If I don't know what you're thinking. You think they will do it? Because this is a national thing. This is going to be huge. It already is, but every day it goes further. This is going to be a bigger deal for all of us.
I'm hoping that they pass it to where they keep them in place for one more year, because again, I'm just looking at every year our carriers go up somewhere between 14 to 30% on premiums. Yeah. So when you're looking at what seems like unchecked premium increases from a consumer standpoint, because I'm a consumer, I buy these plans for me. Mm-hmm. I'm a small business. So when I'm sitting here looking at okay, my plan, in my plan personally went up $500 a month based on this. $500. Now, that's all carrier increase. That's not subsidized. That's just the carrier increases. So when you don't have checks on carrier increases, then the solution isn't just throwing theoretical money at it. I don't know what a good solution is going to be other than pulling this back and privatizing to a degree. Again, I was telling y'all earlier, I've been writing the White House, something I have not done since it was what I was told to do when I was in middle school. And I feel goofy about it, but I feel like if I do nothing, then I can't say that I've done something. And so I've been writing the White House, encouraging this extension just for this open enrollment and true reform. And my ask to the White House every time is, please, 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 this should have been done back in 2013 when they started this. Bring in people like me. Bring in people that are on the ground. Bring in people that know these policies, see these policies, and can sit there and go, okay, this will work, or no, that won't work, and here's why. Not, hey, let's cover every benefit that we think everyone could ever conceivably need from birth until death, or until Medicare, rather, and put it all in one big fuzzy plan, because that's what happened before 2013. If you wanted maternity coverage, you bought a separate maternity policy because it costs money to have a baby. And then there were waiting periods. Well, now I can sell you a policy in November that starts in January, and you can have that child January 2nd, and it's covered completely under your deductible. And then you can cancel it. And it's like, well, that doesn't make sense either. So again, I don't know the ultimate solution. I do feel like for this year, if they do not pass them for one more year and truly work on reform, we're going to see a tremendous amount of people going without insurance, which is then going to overload our emergency rooms even more and our hospitals even more, because we're forcing people to go uninsured. These payments are equal to a house payment. How can you have two house payments? I cannot, I assure you.
As far as the pharmacy part through the marketplace, can you kind of run us through that?
A lot of the marketplace companies do cover true generics. And when I say true generics, the statins, the blood pressure pills, I call those the cheap and freeze, because those are already basically cheap and freeze. They do throw a lot of those in as a copay up to $20, up to $25, things like that. But typically, we tell people you can go to Walmart, Publix, Kroger that have the list of 100 cheaper free drugs, or you can go to GoodRx, or, some solutions like that. Rick was talking about Cost Plus. We've been referring people to Cost Plus lately too, because if you aren't looking at this and trying to think out of the box, you're doing it wrong. You've got to try and figure out what's best for you as far as prescription costs, as far as being creative with that, because the solution isn't to go without medicine you need. It's to try and find it at the most affordable cost for you based on your plan or your situation.
I'm just thinking, when you were talking just a minute ago about it's going to start overloading our ERs and things because people is going to becoming uninsured. So the family doctor at your corner is not going to have the patient intake because they only take insurance patients. So they're going to quit taking those. So it's going to put the bigger burden that we already have in it. Ascension in Murfreesboro, and the last time I had, there wasn't a seat left in that place. And it's all the uninsured that are there. So we'll just add
underinsured, to be fair, because underinsured, if you have a plan, because again, we like the ones that have the $50, $100 copays. If you can't afford that and you need to save $200 a month, and you pick one that has straight up $9,000 deductible, you're going to roll into an ER because, it's going to cost a lot of money, but the hospital will either have you pay not much, anything at all, or put you on payments instead of trying to come up with that money yourself.
What kind of money are we talking? So the example you did was two 30-year-olds.
Two 30-year-olds with a 2-year-old.
That are in good health for the most part.
Yep.
What's somebody at 39 with pre-existing illnesses? going on.
Well, the pre-existing doesn't matter because healthcare.gov is meant to cover pre-existing. But I will say this: yesterday morning, I had a really rough start to my Monday. I had a brand new client call in, and they were so excited because they were about to go on this big trip, and I was excited to help them, and they wanted to get this checked off their list. They're both 62. And they both have pre-existing conditions, meaning we cannot look at off-marketplace plans for them. Mm-hmm. Okay, no problem. But their income was over $85,000, and currently $85,000 for two people is the threshold for tax credits versus not tax credits. Their cheapest premium for two 62-year-olds on Marketplace was $3,400.
A month?
$3,400. I mean, I literally...
A month.
A month. I got sick to my stomach, and I told the guy, I said, you might want to sit down. He goes, oh, ha, ha. I said, I'm not playing. You might want to sit down. And it was for a $7,500 deductible each with a $20,000 out-of-pocket maximum. And the thing is, they both take significant amounts of drugs, and the drugs they take all go to that deductible. So they know they're going to have to pay either $3,400 a month plus $7,500 each in drugs, or we're going to be looking at closer to $4,000 a month to get better drug coverage for them. $4,000 a month, and they aren't seven-figure earners, y'all. They were made just over $100K.
That's half their salary.
Yeah, it is, and it made me sick to my stomach. So again, why I think there needs to be right now things passed just to put those back in place one more season. $3,400 for two people that are 3 years away from Medicare. These folks cannot go uninsured, or they will die because they won't be able to pick up the medicines they need. It's terrifying to me on a level that I didn't think I would ever see with healthcare. And I'm not trying to fearmonger, and I'm not trying to be political. I don't think it's a political issue. I think both parties have been in office, and both parties have done not what they needed to do, and now here we are trying to deal with it. But the solution isn't, hey, let's just cut all subsidies, and by the way, now it's $3,400.
We're here at the end, Rick. What were you going to bring up?
So I guess that part of it, and we were touching on it there, so it does depend on what pharmacy you're using, and you gave great examples of, if you're a Walgreens, Walmart, or CVS or whoever you might go to. But I'm a podcast listening guy, and Mark Cuban, of all people, that if you watch Shark Tank or anything, like he owned the Dallas Mavericks there for a minute, but he's a billionaire, and he's taken this stand that he wants to solve the healthcare crisis and the prescription drug costs that are involved at what we're talking about. But he started the company, and I just went blank on the costplusdrugs.com. So he's basically made a factory that's in Texas that'll ship direct to you, and you go on his little website and he'll show. So he shows you, if you went to Walgreens right now and says, hey, how much is my Eliquis going to be, or how much is my high blood pressure medicine going to be, or this medicine going to be, they're not going to show you. They won't publish you their costs. They want to know what kind of insurance you got, what kind of deductible you got. They want all this stuff so they know how they can charge you for it. He puts it right out there on costplus.com. You can see what it's going to cost. Then he adds 15% to that. So that's their profit, 15% on what the cost of that drug is, $3 for the pharmacy that fills it, and $5 to ship it. And they ship it to your house. So you can sit in your script, basically set up an account with them and let it go. But it's his attempt, I should say, of trying to help with this prescription and drug crisis that we got going on right now. But there's the ways, I won't call it cheat the system, but there's a way to make the system work for you a little bit, if you want to think of it that way. But that's just one of them. And I don't look at him as somebody I look up to, but I got to give the guy kudos of figuring this out. But it operates on 27 employees, and it's all AI driven. And I think Brian said that Walgreens has kind of gone that way now, to where it's all computer related, and they fill the prescriptions, and your labels even have changed. And I've seen the same thing. So
Leanne, we're here at the end. Why don't you remind our audience how to get in touch with you again?
Sure. Our office phone number, 615-345-0411, and our website is covermyassets.com.
You know, you provide an amazing service. God bless you for what you do, because I know 65 and older, you know, I'm sure there's a lot of technology proficient older people out there, but there's a lot of us that aren't. So having someone, you know, that's proficient and professional is a great service.
Thank you. And just remember, I'm going to say it one more time, Medicare will not call you. Do not answer calls you don't know. If it's truly important, they'll leave a voicemail, but it is the way you'll get your plan switched. And that goes for Marketplace as well.
I took your advice from last year, so I don't answer those calls anymore.
Well, thank you. I appreciate it. Are we coming back, Brian? You said there might be a little bit of time, but we're against it, so we're just going to end it right here. But thank you, Leanne, for being with us, and hurry home or back to the office because they're about to start ringing your phone off the hook. Yeah. And she actually answered the phone. Her and Katie or her son are there. So, hey, have a great day, everybody. We'll see you next week.